Hello and welcome back to AP Psychology. I'm Miss Lee and we're still in Unit 8. This video will be focusing on depression and bipolar and related disorders. By the end of this video, you should be able to discuss the major diagnostic categories including bipolar and related disorders and depressive disorders. If you haven't done so already, go ahead and grab your notes and let's get started. These disorders that we'll be talking about in this video were formerly mood disorders. So there has been quite a big shift in between the DSM-4 text revision and the DSM-5, which is the current diagnostic statistical manual that we are using. Now there are two separate categories in the DSM-5. So first, let's talk about major depressive disorder. Depression is kind of known as the common cold of psychological disorders. Somewhere between 6 and 10% of the US population is clinically depressed. It is the number one reason why people seek mental health services. Women are twice as likely as men to experience major depression. Approximately 1/4 of all females will experience an episode of major depression at some point in their lives. So in order to qualify for a diagnosis of major depressive disorder, symptoms must last for 2 weeks without cause, except for those who are grieving. The symptoms must last for at least 2 months. This will include either a depressed mood or loss of interest or of pleasure in almost all activities, and at least 4 of the following symptoms. Oftentimes there are more than just those 4. There has to be some marked weight gain or loss. There should be constant sleeping problems, agitation or greatly slowed down behavior, fatigue, inability to think clearly, feelings of worthlessness, and frequent thoughts of death or suicide. Keep in mind, at least 4 of those have to be present in order to qualify for major depressive disorder. Causes of major depressive disorder from different perspectives. First, the psychoanalytic perspective. This perspective states that losses evoke memories of negative child experiences or unresolved anger towards their parents. From a biological perspective, there is either a lack of or insufficient amounts of neurotransmitters, including serotonin, norepinephrine, and dopamine. And from a social cognitive perspective, there are negative thoughts that influence negative behaviors, and those influence the situation and in turn influence thought patterns. Basically, there is a depression cycle. So let's talk about the depression cycle. First, there is a negative stressful event. All of us go through negative stressful events. However, according to this explanation, there is a pessimistic or ruminating explanatory style. This leads to a hopeless, depressed state, and this hampers the way that the individual thinks and acts, and therefore fuels the personal rejection or the feeling of being personally rejected, and this can exacerbate that negative stressful event. So through the behavior of the individual experiencing this cycle, they can influence their environment, which therefore exacerbates the situation. You may think back to previous videos where we talked about reciprocal determinism. Persistent depressive disorder used to be known as dysthymia, and many clinicians still sort of refer to it as dysthymia out of habit. Although it's less debilitating, this disorder is marked by chronic low energy and poor self-esteem, and it's seen as a more low-grade but longer-lasting depression. So it's kind of like being constantly down in the dumps. If you think of the character of Eeyore on Winnie the Pooh, that's kind of persistent depressive disorder. Disruptive mood dysregulation disorder. This used to be known as childhood bipolar disorder. This is where a child is irritable or angry all day long, and they can experience temper outbursts at least 3 or more times per week. Let's talk about bipolar and related disorders. This disorder used to be known as manic depressive disorder, and basically there is an alternation between depression and mania. This is what is primarily going to signal or characterize bipolar disorder. When a person is experiencing the depressive symptoms, they can be gloomy, they can be withdrawn, they can be unable to make decisions, they may be tired and have slowness of thought. During a manic period, the person is going to experience elation, euphoria, a desire for action. They may be hyperactive and they can have a lot of ideas all at once. Many great writers, poets, and composers suffered from bipolar disorder. During their manic phase, their creativity surged and dropped off during their depressive phases. Here are some of the more well-known artists who suffered from bipolar disorder. You've got Walt Whitman, Virginia Woolf, Samuel Clemens, who is, of course, Mark Twain, and then Ernest Hemingway. Bipolar disorder is subcategorized into several different descriptions. There's bipolar 1. In this disorder, a person will experience manic episodes and usually major depressive episodes. In bipolar 2, a person will experience mania to a lesser degree. It's called hypomania. Most patients who experience hypomania do not see it as a problem, yet the people around them may be concerned about their erratic behavior. At least 4 days of hypomania have to be present in order to qualify for a diagnosis of bipolar 2. A related disorder is cyclothymic disorder, and this is where someone has hypomania and depressive symptoms for at least 2 years, yet the symptoms do not constitute full major depressive episode or mania. Causes of bipolar disorder. So there are a couple of different perspectives. First and foremost, there's a biological perspective. The evidence for inherited predisposition is very strong. 2/3 of those with this disorder have a family history of mood disorders or disorders that used to be known within these mood disorders. There also appears to be some psychosocial factors in triggering new episodes or preventing them. Researchers have found that stressful events often trigger manic episodes. So take a look at these brain scans. These PET scans show that brain energy consumption rises and falls with manic and depressive episodes. So you have a person with bipolar disorder and you see the different fluctuations of energy being consumed or glucose being consumed during these different states. So you have the depressed state at the far left, the manic state the next day, and then again the depressed state once that mania has subsided, and you see even less energy being consumed. So there's less activity going on in the brain during these depression states. And that is it for depression and bipolar disorder and related disorders. In our next video, we will continue to look at specific diagnoses in clinical psychology. I can't wait to see you then. Bye for now.